Hi everyone, my name's Heath Harmon. I'm the Director of Eagle County Public Health and Environment here in Eagle, Colorado. And today I wanted to talk to you a little bit about coronaviruses. As the coronavirus or the disease COVID-19 continues to spread throughout the world, I thought it was really important to be able to share some key facts with you. So first off, what is a coronavirus? Well, these viruses have been around for a while. They cause illness in people, they can cause illness in animals. However, over the past 2 months, a new form of this virus that causes a disease, COVID-19, has emerged. And I think we all understand that this emerged in China, but now it's really widespread throughout the world, causing community-level spread. And these are some things that we want you to be aware of. So what are the symptoms? I want to highlight that about 80% or more of the people that actually get infected with COVID-19 have relatively mild symptoms. They can include fever, cough, shortness of breath. And again, those 80% of people infected do not actually need medical intervention or treatment of any kind. They recover completely on their own. There is, however, a group of people that are at greater risk for complications. And so that is primarily older adults, age 80 and older, or individuals that might have underlying or pre-existing health conditions. For those individuals, complications can include pneumonia, hospitalization, and the most severe form, it can certainly cause death. So how is it spread? Well, it's spread through respiratory droplets. These are large droplets that traditionally are then sort of expelled when somebody coughs or sneezes. And so somebody can get infected if they're around a person that has COVID-19 that is coughing and sneezing, and you actually inhale those droplets, or when the droplets themselves get on surfaces and contaminate them, and then you could walk by later, touch that surface, and before washing your hands, you've touched your mouth or your nose or your eyes. So that leads me to a couple of thoughts in terms of how can we best protect ourselves. Really simple stuff here. Hand washing is going to be one of the most important things. Spend about 20 seconds washing your hands with warm water and soap. If you need to, sing the ABC song, or you can sing Happy Birthday. By the time you finish that song, your hands should be nice and clean. If you don't have access to a hand sink and or soap, you can use a hand sanitizer. Just make sure it's alcohol-based. It's a good substitute, but if your hands are visibly dirty, it's not going to be as effective, and you really should find that hand sink. Another key element to protect yourself and then those around you is cover your cough or your sneeze. Now, you can do that with a tissue, or you can do it into your elbow, just like that. But what that does is if you are infectious and you're coughing or sneezing, you're preventing those droplets from going out into the air or contaminating surfaces or exposing your friends or family members. So another thing that you can do is keep some distance from people that you know are sick. If they're coughing or sneezing, what you really want to do is stay back at about 3 feet to maybe 6 feet. So that's some information about the disease. What I really want you to understand now is what are we doing here at Eagle County and with our partners to prepare for the arrival of COVID-19? Well, our goals primarily are going to be these 4 things. We want to rapidly detect the virus's arrival in Eagle County. Once we do detect it, we want to make sure that we can slow down the spread in our community. Again, back to those personal protective precautions. Those things will help slow the spread in our community. We also want to limit the worried well from showing up in our medical clinics, urgent care, or emergency departments. If you have concerns, you can always call your healthcare provider in advance, but we want to avoid those walk-ins. That telephone call will allow us to provide guidance and a little bit more information about where to go for testing and or whether testing is even necessary. So what's key also in terms of our goals is protecting the most vulnerable in our community. As I mentioned earlier, if you're 80 years of age or older, or if you have underlying health conditions, you're susceptible to the more severe form of this disease. And so it's upon all of us in the community to do what we can, not only to protect ourselves, but also protect those that are most vulnerable in our community. So where can I go for more information? Well, if you have just general questions, what we're going to do is direct you to the Colorado helpline. That number is 1-877-462-2911. They do offer translation services. That's really helpful. And then also we have ecemergency.org. This is going to be our key go-to for local information. It will provide a lot of the information I've already talked about, but also it will be updated on a regular basis, and we can push alerts if you're interested in signing up for that. So thank you for joining me today, and thank you for doing your part to help slow the spread and protect yourself from COVID-19. Thank you.